Hi, everybody. Good afternoon. I'm Dr. Angela Rasmussen with the Save America Movement Steering Committee. I am here today with my wonderful colleague, Jessica Malaty Rivera, who I joined on Wednesday to basically cover all of Surgeon General nominee Casey Means' hearing before the Senate Health, Education, Labor, and Pensions Committee to decide if she is qualified to be the next Surgeon General of the United States. So it was a pretty bad hearing overall in terms of Casey Means being particularly persuasive, at least to experts, that she is in fact qualified. She is a conspiracy theorist and profiteer who is essentially selling cures for diseases that don't exist to people. And our concern is that as Surgeon General, not only are these ideas based on not science, but they are also going to be treatments that she offers to Americans instead of evidence-based therapies, as the Surgeon General has historically done. So without further ado, we're just going to get right into it. And Jessica and I are going to break down some of, I think, what are the most important take homes from this nomination and some of the things that people have been saying about it ever since the nomination hearing. So Jessica, why don't you chime in here with some of the things that you found the most notable about the hearing and some of the things that we should probably be unpacking today?
Yeah, so glad you all are here, and again, thank you for sharing the coverage that we had the other day. We hope that this is a helpful resource. We'll be doing this a lot more to help kind of make it all make sense as we navigate this time in American public health history. But what's interesting, Angie, right now is thinking about the fact that there are a lot of people scratching their head, people on the committee and people off the committee. And yesterday, Politico reported that a number of senators who sit on the Health Committee have not yet made their decision, which is a little concerning because it, at least to us, felt like it's quite obvious how unfit she is for the job and how she demonstrated her lack of fitness for the job for 2 consecutive hours during the hearing. But because of her non-answers, it has left, I think, intentionally a cloud of gray that is giving folks, I think, some false hope or even perhaps optimism that she is amenable to conversation, that she's willing to negotiate. And this is honestly a little triggering when we think about the history of what happened on the same committee when RFK Jr. was confirmed. RFK Jr. said with his whole chest, I believe in the pediatric vaccine schedule. I have no plans to change the pediatric vaccine schedule. And yet here we are, exactly a year later. The vaccine schedule has been slashed from 17 recommendations to 11 and everything else in between that he's done. And so I think that the media training that she had, the prep that she went into was obviously extensive because it has done at least what they intended to do, which is to not make it a categorical no right away. It's to have them all scratching their head and wonder, could she be Surgeon General? Maybe she would be a really good one. And I'm concerned that it's the obvious players. We read from the Politico article yesterday that it's Murkowski, Collins, and no shocker, Bill Cassidy, who have not committed to answering the question of whether or not they would advance her to the next step. But I've also read people say that there's a lot of answers from other folks on the committee who have said some weird, almost neutral comments about Casey Means and the hearing itself, which is concerning.
Yeah, I think that this is a really great point because, in my view, when somebody gets up like Casey Means to take a job as important as Surgeon General, a job that is important enough to require Senate confirmation. And the way that Senate confirmations work is they go through these different committees that are stacked with at least some of the expertise that would be needed to actually evaluate this. So,
Yeah.
for example, Senator Bill Cassidy, who you mentioned, is a board certified hepatologist. He's a clinician. He actually has extensive expertise in the hepatitis B vaccine, which is, I'm sure, one of the reasons why he has some reservations about her.
Hmm.
But you made a great point in that mentioning that several people who would otherwise be completely opposed to this person is like, well, she said some things that I don't disagree with.
Yeah.
And this has been a persistent problem, and specifically with the Democrats, where you have somebody who recognizes clearly that this person is not suited for the job. But then, in the interest of fairness, in the interest of seeming as though they're not biased or being too political, they will
Mm-hmm.
say, well, in fairness, I agree with this. I think this is a great idea. And so, therefore, that somehow cancels out all of the insane stuff that she said separately from this. I
Yeah.
mean, this woman believes that COVID is a metabolic disease.
Yep.
It's not caused by, she talks about the root causes, and we talked about this a lot on Wednesday. Casey Means practices what she calls functional medicine, and this is not actually a recognized branch of medicine, but this is basically a strategy for taking a lot of medical measurements, such as with a continuous blood glucose monitor, which is what Casey Means company sells, and using that data to suggest remedies for diseases that are not even really diseases,
Mm-hmm.
things that are essentially made up. So this is the type of medicine that she practices. And anybody who recognizes legitimate medical practice will know that this in itself is disqualifying.
Mm-hmm.
She is saying that the root cause of a viral infection is not the virus that causes the infection. It is the fact that your mitochondria aren't working well enough because you're not taking the supplements that she's recommending through her sponsored content on her Instagram feed. And that is not an acceptable paradigm for practicing medicine. That is certainly not the medical paradigm for treating
Yeah.
patients that America's top doctor should have.
Yeah. I mean, and I think that's exactly right. What concerns me, I mean, there are many things that concern me, but it's this idea of, well, how can we work together? And I am not saying that we have to all agree on every single thing. However, there were fundamental things that she disclosed in her non-answers that were as isolated statements disqualifying for the job of Surgeon General. The Surgeon General is considered the nation's doctor. The Surgeon General is considered the nation's top science communicator to represent the data on hazards and risks to the population for the purpose of what she kept referring to, population health, and population level outcomes, which she denied even understanding or knowing or being familiar with effectiveness data for the flu vaccine. There's no chance in hell that she was unfamiliar with the fact that flu vaccine data has historically always shown that it reduces the risk of hospitalization and death, especially among children. And to play around with her words so sneakily and instead redirect the conversation to informed consent, thereby suggesting that doctors around this country are, I don't know, pushing their parents outside of the room and vaccinating the kids, and there's no discussion and no words exchanged at all. I mean, how unbelievably insulting to all practitioners in this country. I can absolutely empathize with the fact that the patient experience may not be ideal right now because we have a massive shortage of providers in this country. And part of that is because it's expensive to become a doctor. Payments for doctors are not great, despite what MAHA wants you to believe. Doctors don't get pays or kickbacks from vaccine doses that they're giving. And even still, appointment times are short and people don't feel like they're getting enough time with their providers, but it is absolutely categorically false to suggest that people aren't being told about the risks and benefits of vaccines. And so I think it's really, really scary that the answers that she gave about healthcare and even nutrition were somehow enough to assuage or to forgive, really, the answers that she said about measles, the answer that she said about flu, the answer that she said about hepatitis B. She tweeted in 2024 that the hepatitis B birth dose is a quote crime. That is indefensible and it is disqualifying as the Surgeon General.
Yeah, no, absolutely. I mean, this is where it all comes down to. If somebody is saying, for example, I don't have any idea what flu vaccines do. Maybe they work, maybe they don't. Who knows? Well, gee, it's not like we've been using inactivated flu vaccines for, 70 years, and these vaccines have fundamentally not changed that much in terms of how they work. There are a few differences in formulation that have been made over the years, but for the most part, flu vaccines work pretty much the same way. And we have lots of information about this. This is a
Yeah.
very common piece of anti-vaccine lore where because flu shots are not perfect
Yeah.
against preventing infection, that means they don't work at all. And that's what she's getting at without actually saying it. And when you said that her answers were very sneaky and the result of extensive media training, I fully agree.
Yeah.
Because the way that she framed that was not actually saying, I don't think flu vaccines work. It was
Hmm.
saying, I don't know.
Yeah.
Now, normally, and
Or
I
I've
tell
not
my
seen that data.
I've not seen that data. Now, normally, I tell my students and my trainees that that is an appropriate answer to give. If you don't know the answer, you always tell the truth as a scientist.
Yes.
You say, I don't know. But what you do say in addition to that is, we don't know scientifically. Maybe I don't know that because I need to review that data more closely, but we don't know that scientifically because of this, this, and this. And this is what we would need to do to find that out.
Yeah.
She did not provide that because, well, we actually do know the answer to this. She revealed in that she hasn't done any of the basic background research that would be required to be Surgeon General. If
Yeah.
you are the Surgeon General of the United States, you better have a pretty good idea of how flu vaccines work, considering
Yeah.
that is something that has been part of America's public health plan for the last, again, 7 decades.
Yeah.
So the fact that she didn't do that is, at the very least, whatever you think about her ideas, that shows that she just didn't prepare for a job interview for one of the most important jobs of her career.
She did the same thing with the autism question, right? So she instead said there's an autism crisis and we don't know what causes autism. But the question was not what causes autism. The question was, do you accept the mountains of data that have basically said vaccines are not the cause of autism? We can absolutely agree that there are a number of other factors, including genetics, which somehow is not an answer they're willing to ever include, but that vaccines are not it. And instead she said, well, the science is not settled. No, I don't want to leave any stone unturned. And again, this is a way to appear altruistic. This is a way to appear sincere in your scientific journey of wanting to answer questions. But the problem is, these are not honest questions because the questions have been answered prior. This is a very, very dishonest way to say we're going to do the research by wasting taxpayer dollars to repeat and repeat and repeat experiments we've already done for decades, literally decades, to find a causal link between vaccines and autism. And we have never been able to do that. And yet say, well, the science is unsettled, and so I'm going to be here to make sure that we're answering all the questions. Again, it's a very, very deliberate use of words to make it sound like she's going to come in and be open to everything, which makes her sound like a team player and makes her sound like she's open to working with both sides. And that is dishonest because she's not. She has the answers already. And she has let them be known on every podcast you can imagine. All you have to do is Google Casey Means name and find her on every single wellness podcast with her whole chest saying wild, wild things about vaccines, about autism, about metabolic health, about nutrition,
Estrogen,
about
reproduction.
estrogen. About, I mean, it's very, very deceptive.
Yeah, I mean, her entire talk was very deceptive. And I think it was one of the things you just said there, talking about all of these different things where she wouldn't answer direct questions and she wouldn't answer the question that she was asked. And one of the moments in the hearing that to me was the most telling of this was when Bill Cassidy at the very end was asking her about her opinion of
Yes.
the hepatitis B vaccine birth dose. So he kept asking her over and over again, do you think that universal birth dose of hepatitis B vaccine is a good idea? The data supports that it is a good idea. The data supports that it almost eliminated HBV in the US, and it has eliminated HBV in many other countries, including Denmark, which was the basis sorry, not in Denmark. It eliminated in other countries so that it never became a problem in Denmark.
In places like Denmark,
it was never
yeah.
endemic in Denmark.
Yeah.
And that's what we made the decision to can that birth dose on was based on the data from a country that's never had the same issue with HBV.
And a country that has incredible data coverage of everybody's hepatitis status, which is very different from our ability to have epidemiological data on our population.
Exactly. Like Denmark's nationalized healthcare system and probably best in the world
Yep.
data gathering system is exactly why they don't need to have the universal
Yep.
birth dose in Denmark. But that is not why we don't need to have the universal birth dose in the US. Now, that wasn't the question, though, that Cassidy asked her. He asked her, do you think personally that
Mm-hmm.
this is a good idea? All the data says that it is. What do
Mm-hmm.
you think? And
Mm-hmm.
she kept saying the same stuff that she was saying about autism and the MMR vaccine and the cause of autism. All of this stuff. The science isn't settled yet. I'm open-minded to new things. I think we need to get out of this trusting the experts mentality, because those experts just want to give you vaccines and they just want to hurt your family and so they can profit from it.
Yeah.
But the fact is, and I said this in the hearing and I say this all the time, every accusation is a confession.
Mm-hmm.
The fact that Casey Means never answered Bill Cassidy's question about whether she thinks universal birth dose of HPV is a good idea is because she's not going to answer that question
Yeah.
honestly.
Yeah.
She already did, as you
Yep.
pointed out in that tweet where she called it a crime.
You know what's so interesting too is that she kept saying, I'm nobody's physician, or that, I'm not going to be prescribing medication, or, it's making the distinction on individual versus population. And then even in the answer of flu vaccines, talking about, well, it might do that at a population level. As the Surgeon General, your recommendations are in consideration of, wait for it, the population. You are going to be providing warnings based on population level harm reduction. That is basic public health. And so when you're talking about the distinction between individual care and informed consent, but yet we're trying to deflect to population health, your whole job description as Surgeon General is to consider the totality of the nation's health and making recommendations to reduce collective harm. We do that by vaccinating at the with the birth dose of hepatitis, because we know that the totality of evidence shows that the population benefits by 90% reduction of chronic infection with hepatitis if babies get vaccinated at the earliest point, which is birth. And so it's unbelievable to me, somebody who doesn't understand the basic epidemiology of vaccines and why we do vaccines. It is literally not just about individuals, it is about population health.
Yeah, and I mean, I think it's really funny. This is something that gets obfuscated with vaccines all the time, that even though the reason we use vaccination is because of those population health benefits that you mentioned. The measles outbreaks are a great example of this.
Yep.
Not everybody can take the measles vaccine, and measles is an incredibly contagious virus. But if we get 95% of people who can take the measles vaccine,
Mm-hmm.
we won't have measles for anybody. And that benefits everyone, the entire
Yep.
population, even though there are individuals within that population that the recommendation to get a measles vaccine doesn't apply to because it's medically counterindicated.
Yep.
So we are used to thinking about this in terms of population health, but population health does have huge individual benefits for people.
Yes.
So if you are not one of those people who can get an MMR vaccine because you're immunocompromised, or you've had a bad reaction to eggs, or you've had a bad reaction to vaccines or whatever, you don't need to, because everybody
Mm-hmm.
else who can get one is going to get one. And so you all benefit. Those
Mm-hmm.
people don't get measles and you don't either, even though you're unvaccinated. What they are saying is that because there are these unvaccinated people who can't get vaccinated, it should be a choice for everybody. And it already is a choice for everybody. A person can walk into their doctor and say, yes, the MMR vaccine was recommended, but you know what? I don't want to take your recommendation. And people don't have to. And as you pointed out earlier too, there is no forced vaccination. This informed consent issue is total bullshit. The idea that doctors are kicking parents out of the room and forcibly vaccinating their children without their consent is absurd. That does not happen. The vaccine schedule recommendations, parents could take them or leave them. Most of the time they chose to take them because there's lots of evidence supporting how much they will benefit their children and society. And that's what population health is all about.
Mm-hmm.
It's about the safety of the population, but you talk about it on the individual level. You
Mm-hmm.
explain the individual benefits, and there are huge individual benefits to vaccination.
Yeah.
And
Yeah.
this constantly gets obfuscated, where you have these people saying, well, science isn't settled. Guess what? The science is never settled. There's always more that we can find out. And I say this as somebody who's literally a scientist as a profession. Nothing's ever settled, but sometimes some things are settled enough that you don't need to think, well, what if this isn't really true? Because again, with all of these vaccines, MMR, flu, the ones that she's talking about, even HPV, which is a newcomer, it's been around for 40 years. These vaccines have been around forever. We know that they work.
Yeah.
And
Yeah.
she is pretending that they don't because either she is lying or she's not familiar enough with the data and she's not an expert in this field and she's incompetent and unqualified for the job.
Yeah. 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 Speaking of qualifications, I do think that this word salad answer about her license is really interesting because she's making a distinction that she has a license, it's just inactive. And I think what she's trying to say is that it's current and voluntarily inactive and somehow different from more negative attributions or statuses like revoked or lapsed or suspended. However, she is not licensed to practice today because it is inactive. Whether or not you want to say that the license exists is not the question. She would be the first and only Surgeon General in US history to come into this position without an active license. And then she said she had no intention of reactivating it, even though she said it'd be very easy. I could just go to the Oregon State Board and have them do it. So why not, Casey? It's curious to me why she had such a strong answer to signal, I'm a physician, but I don't have a license that is active. Don't you think that's weird?
Well, I think it's very weird. And I think it's also, again, disqualifying because she would be the only member of the U.S. Public Health Service Commission Corps without an active license to practice medicine. And that's kind of a bad thing considering the Surgeon General is actually a military rank because the U.S. Public Health Service is part of the larger military, even though they're not an armed branch of the armed forces. You know, she's a general. She's going to be a general and she's going to be the commanding officer of everybody in the Public Health Service Commission Corps. How could you possibly have the person in charge unable to do the core function of their job, which is to be a physician?
Yeah.
You can have an MD degree. That means you're a medical doctor. That does not mean that you're a practicing physician.
Yeah.
And she hasn't been a practicing physician for the last whenever she finished her residency.
She's also never practiced unsupervised medicine, but yet she said when I was performing surgeries and when I was seeing, she never did so unsupervised because she never finished her training to allow her to do so. And again, she'd be the only person in this entire corp to have never done that.
She also heavily misrepresented her background entirely. She said that I've seen thousands of patients, which is probably true because
as a resident,
when you're in medical school, also,
sure,
you go around like I think the last year or two of, I mean, I didn't go to medical school, I have a PhD, but the last year or two, you do clinical rotations. And so in the course of that, you will be following around basically a resident or a fully trained doctor, and you will just be observing as they treat patients. I think she's counting that as treating patients. She's also counting, as you pointed out, all of the supervised surgeries and patient care she provided during her residency, which is the purpose of a residency, by the way. It's to extensively get experience treating patients. So that way, when you're done with your residency, you don't need to have somebody who's actually experienced looking over your shoulder. Yeah. There's confidence you're not going to kill your patient because you're competent.
Yeah.
She couldn't handle that and dropped out of that. But she yet talks about how she has 15 years of experience in medicine. Okay, she's 38 years old. Medical school takes 4 years. This was a 5-year residency program. Her undergraduate at Stanford was 4 years. So she's talking about 12 years. Sounds like she's counting her undergraduate too. And, you know, I went to a good college for my undergraduate. I was in a pre-med program. Guess what I never did once? Treat a patient.
Never.
It's like taking organic chemistry classes and preparing for your MCAT. Like it's not actually being a physician when you're an undergraduate. Give me a break.
Yeah.
So she's really, really padding her resume and her clinical experience. And I find it very interesting. The one last thing that she didn't mention is that she claims to have some sort of made up board certification for functional medicine board, which is not a recognized branch of medicine. So she chose to drop out of her residency for ENT surgery, did not get board certified in that, which is a legitimate medical profession. and
Mm-hmm.
instead chose to become an Instagram influencer who has this made up certification that,
Yeah.
allows her to treat
Yeah.
patients by optimizing their
Yeah.
mitochondrial function.
I think we are in a dangerous time in US history where, we've had these credentials and requirements for a reason. It's to keep the integrity, specifically the scientific and medical integrity of certain positions intact. And any other person who has applied to be part of this workforce who has not had these credentials has been considered unqualified for the job. And yet, we are considering the person who is the head of this entire workforce without this qualification a credible candidate. And I think right now, as we kind of wrap up before, today, all eyes are on the House Senate Help Committee, which has physicians on it, who should know the power of the credentials and board certification and active licensure to make decisions on people's health, on individuals' health and population's health. And I think that if you live in the states of Louisiana, Maine, and Alaska, to please stop and don't stop calling and writing and messaging your representatives, because at this point, we could see a really, really dangerous decision being made for all of Americans' health. We're not being hyperbolic when we say that the implications of America's top doctor not understanding or not admitting to settled science about vaccines and autism, flu vaccines, hepatitis vaccines, and even nutrition. For goodness sakes, she believes that raw milk is a fine thing to recommend for people. We are really
Only if you talk
setting
to the
out.
cow first.
Oh, God, yeah. We are really on a road to seeing many, many more Americans getting sick.
No, I couldn't agree more, Jess. And I think that, one of the things that you and I have been talking about a lot is that we're going to be doing this a lot more frequently
Yeah,
because a lot of these issues are really deep. And in order to explain them to people in a way that you guys can access and really get like how bad this decision is, I do think that it's very helpful for us to kind of talk about all of these issues because most people don't actually just think of this stuff as much as we do. And frankly, it's a little bit boring to think about if it's not part of your normal job. So
yeah,
we've decided that, to help us make sense of it too, because it is bizarre, I
it
have to say,
is.
from a personal perspective, to see this happening in the Senate Help Committee and to
Mm-hmm.
even see her appearing there, much less all the other people who've been installed throughout our government. So I think this is a real issue that's going to continue going on far beyond Casey Means about everything that's happening right now to our country. And I think it's really important for us to keep discussing it. And one last thing I just want to flag for everybody is that it does seem like our coverage of the hearing was really helpful to a lot of
Yeah,
people. And it made the hearing, I think, more accessible to people. And it also made it kind of entertaining because I do like to think that I'm pretty good at like busting on people that I don't have any respect for. And I think, Jessica, you are great at being sort of my helper in that. But also, you are particularly great at explaining how this information sort of percolates through this system and actually has an impact. And I think that's really important for people to understand too, to get around these techniques. So the last thing that we're going to do is on March 18th and 19th is the Advisory Committee for Immunization Practices meeting,
we'll
which
see.
was, we'll see, but it is in the Federal Register now. So it does look like it's going to go forward. And the rumors are is that it's going to be a huge bloodbath for COVID vaccines, mRNA vaccines, fertility policy with
RSV.
regard to vaccines, RSV, and also the methodology that they're even using to make evidence-based recommendations. And spoiler alert, I bet it's not going to be very evidence-based. So Jess and I are going to cover that. That's going to be 2 long days. So please give us feedback also about what you liked or didn't like about the Wednesday hearing coverage. We've already thought of some ways to make it a little bit easier to understand what we're saying versus what the speaker's saying when we're doing this live. So we're really going to try to do the ACIP meetings so that it's going to be 16 hours of fun, but also so that you guys can really understand what's happening behind the scenes so we can stop it now rather than in a couple years when we really start to see those mortality numbers tick up.
Yeah,
So I'm just going to leave you all with that. Thank you so much to the Save America movement for making
yeah,
this all possible and giving us this wonderful studio to work in, and for just being a wonderful organization to work with to fight back against all of this. If you are at all considering joining a community that is completely opposed to what's happening and is going to take action to make sure that this doesn't happen, which right now is call your senators and tell them not to approve Casey Means. going forward, the Save America movement has been instrumental in helping organize some of these actions. So we're really grateful to them, and I'm really grateful to be a part of it. Thanks, everybody, for joining me and Jessica Malaty Rivera, my wonderful colleague, for this episode of what we're going to call Taking Shots, and we'll see you very soon.
Thanks, Angie. Bye, everyone.